So we did OBG, right?
Yeah, we did OB, we did renal, we did endocrine, we did cardiovascular.
Hmm.
Okay. Yeah, that's so far. Okay, so now the
And
GI.
we did surgery.
Yeah, surgery. Yeah, that's good.
OBG and cardio.
Okay, let's have some fun with some more clinical scenarios. If you are a 45-year-old Asian American female with bloating, flatulence, abdominal cramps, and explosive watery diarrhea. Okay, what's your diagnosis here?
Lactose.
Yeah, excellent. It's a lactose intolerance.
Hmm.
They have positive hydrogen breath test.
Hmm.
If you are a 51-year-old male with alcoholic pancreatitis who has a palpable crepitus in the suprasternal notch. What does that tell you? Palpable crepitus in the suprasternal notch. I can't make
It's
it easier for you by giving you severe retrosternal pain and upper abdominal
also
pain.
esophageal rupture.
Yeah, perforation.
Yeah.
Okay, if you are a 35-year-old woman with a retrosternal pain that precipitated by emotional stress and
Mm.
sublingual nitroglycerin relieve the pain. So what's your diagnosis?
Esophageal spasm.
Yeah, so we do manometric recording, esophageal motility study for diffuse
Hmm.
esophagus.
What do
Okay,
we do initially? What was the initial test?
manometry,
Okay.
diffuse esophagus.
Mm.
Okay, if you are a 42-year-old male with watery diarrhea, skin rash, and pigmented scaly skin rash on the malar distribution of the face, and dementia.
Oh, niacin.
Pellagra, yeah, good job, Nancy.
Yeah.
If you are a 45-year-old male with chronic diarrhea and you lost a bunch of weight, like 15 pounds, okay, the D-Xylose solution, when I gave you the 25-gram D-Xylose solution, okay, there's excretion of D-Xylose at 5 hours is 1.2, normal is 4 to 7. And after
Okay.
after 4 weeks of rifaximin, I repeated the D-Xylose and I found it the same. So what's going on here?
It looks like a celiac disease.
Good job. Yeah, it
So
is.
if you do the antibiotics and it works, then that means what do you call it? Small bowel growths, overgrowth, something, right?
Small intestinal bacterial overgrowths.
Mm-hmm.
SIBO. I'm joking with you. SIBO.
What?
SIBO is called small intestinal bacterial overgrowth, I think.
I'm like, what is he doing?
No, I'm joking. Okay, so 40. If you are a 41 Caucasian male who have a chronic alcoholism, acute pancreatitis, you presented 4 weeks after acute pancreatitis with a palpable mass in the epigastrium with pain radiating to the back.
So you're an alcoholic and you already have chronic pancreatitis.
You had acute pancreatitis, and then 4 weeks after you had a palpable abdominal mass. So what is causing this? What the hell is going on?
Is it pseudocyst? I don't know.
Yeah, excellent. It's a pseudocyst.
Okay. Okay.
If it was abscess or some necrosis, you'll have systemic signs and stuff.
Mm-hmm. Okay.
Now, if you are a 56-year-old male okay, who develops fever on the third post-operative day, and you have a marked right upper quadrant tenderness with leukocyte of 17,000. Okay.
Post-op day 3.
Yeah, you're on mechanical ventilation. You had a bunch of medical condition. You had a cabbage. Okay, and post-op, you had right upper quadrant pain.
Mm-hmm. Is it a calculus?
Yeah, excellent. A calculus
Okay.
cholecystitis.
Mm-hmm.
Now, if you're a 34-year-old woman with a daily crampy abdominal pain for the last 2 years, and you had passage of small loose stool and mucus, okay, after which you feel better, what is your diagnosis?
Is it IBS?
Yeah, it's irritable bowel syndrome, so you have normal colonic mucosa. What
Mm-hmm.
are the Rome criteria for IBS?
Oh my. I know that one is abdominal pain getting better with defecation, and then alternating constipation and diarrhea. Those are the two that I know.
The third one, change in form of stool, yeah. So
Changing from a stool. Okay.
symptoms improve with bowel, number one. Second, change in frequency of stool.
Mm-hmm.
Third, change in form of stool.
Okay.
Recurrent abdominal pain discomfort more than 3 days a month for the past 3 months,
Mm-hmm.
and more than two of the following, the one that we talked about.
Mm-hmm.
So, what are the warning signs that suggest something else? They are, if there is rectal bleeding, then it could be something else. Nocturia,
Mm-hmm.
like awaken from sleep,
Mm-hmm.
something serious more than IBS. Weight loss, anemia, electrolyte abnormalities, suggest something else. Now, if you're a 33-year-old woman with a dull aching pain in the right upper quadrant, okay, and the abdominal ultrasonogram shows solitary hyperechoic 7 cm lesion in the right lobe of the liver. What's your diagnosis?
Is this patient on OCP?
Yeah, yeah.
You don't want to give me that, huh?
But I'm impressed. Look at you. Good job. Because you know
Hepatic adenoma.
your intelligence is so high. Okay, so I'm trying to challenge your high IQ.
Bring it on.
Yeah.
He's gonna help me.
Yeah, good job. Yeah, so it is hepatic adenoma. So there's one question. I still remember that I did that mistake.
Mm-hmm.
I didn't pick it right, and
On your real exam?
it was very sad.
On your real exam?
No, I think it was in Kaplan Q Bank.
Oh my goodness,
Yeah,
please.
yeah, but I felt so bad that I missed it, and I knew it. So that's the thing, and it's a very tough one. So it's the same similar scenario, but if there is similar scenario, when you do ultrasound of the liver, you found central scar on imaging and arterial flow.
Yeah, that's the focal nodular
Yeah,
hyperplasia.
anomalous arteries, focal nodular hyperplasia. Yeah, good job. Yeah, so that's why I remember I did that mistake. So now you got it right. Good job. Yeah, regenerative nodules, cirrhosis. You know that. Hepatic adenoma,
Mm-hmm.
possibly hemorrhage can transform to malignancy too. So you
Mm-hmm.
gotta be careful with that.
Okay.
Metastasis, it can be single or multiple.
Mm-hmm.
Okay, and should be known extracellular cancer, extrahepatic cancer. Okay, now if you are a 45 male with heartburn and hiatal hernia, what are the complications for this condition?
Heartburn and hiatal hernia.
Mm.
What are the
Yeah, complications for that.
hiatal hernia? I guess the person is gonna have like acid reflux, right? God.
Yeah, adenocarcinoma of the esophagus can increase risk for that.
Right. Barrett's esophagus, yeah, and adenocarcinoma.
Okay. So what are the risk factors for squamous cell carcinoma?
Squamous, oh, okay. Smoking and alcohol. Esophageal, right? Squamous cell.
Yeah, smoking, alcohol, dietary deficiency of beta carotene,
That high intake
zinc,
of
yeah, zinc, selenium, environmental, viral, toxin, hot food, beverage, pickled vegetables, food rich in beta nitrosamine. Okay.
man, that's a lot.
Yeah.
They just want people to drink water, huh?
Yeah, just water should be fine.
No side effects yet.
Yeah. How about the risk factors for adenocarcinoma?
So adenocarcinoma will be
Obesity,
yeah,
high dietary
obesity.
calorie, take
Mhm.
fat intake, smoking, medication that promote GERD. Yeah, those sorts of things. So this is about risk factors of esophageal.
If they ask you what is the most common risk factor for adenocarcinoma, do you go with a GERD or do you go with Barrett esophagus? Which one?
GERD.
Okay.
Yeah, GERD because Barrett esophagus. The usual, I don't think they're gonna bring both at the same time. The
Okay.
same answer choice. Okay, if you are a 42-year-old obese female with a right upper quadrant pain radiating to the right
Mhm.
scapula, I mean,
Mhm.
it's okay, you know that, I know. This
No,
is,
keep going. Let's
yeah,
keep doing it. Yeah, that's fine. Hey.
yeah, this one just like cholecystitis, that,
Mhm.
yeah.
Oh,
40,
they how many F's?
40 fertile female. Okay,
Yeah.
now a good one.
Fat.
Yeah. Now, if you are a 23-year-old male with foul smelling, bulky stool, weight loss, okay?
Mhm.
Biopsy shows villus atrophy. So I ordered the transglutaminase antibody screen, and that was negative.
Mhm.
So what's diagnosis? What's causing this?
I think they said it can still also be celiac. That sometimes it's not gonna be like 100%, positive in all celiac disease patients, right?
Yeah, so celiac can present with bulky, foul smelling, loss of muscle mass due to fat and protein malnutrition, loss of subcutaneous fat, fatigue. They have iron deficiency because anemia, fatigue. They can have calcium, vitamin D deficiency because bone pain, osteomalacia, fractures, osteoporosis. They have vitamin K deficiency because easy bruising. They have vitamin A deficiency because hyperkeratosis. So it's a terrible systemic illness. Now, it's very good question. 42-year-old male. Okay, so if you're a 42-year-old male with skin rash and hair loss, when I
42-year-old male. Okay.
yeah, skin rash and
Skin
hair.
rash.
Yeah, even if
Yeah.
I just tell you skin rash and hair loss, this is unique for one condition. But I'm gonna make it easier by giving you the physical exam showing alopecia bullous pustular lesion around the perioral and periorbital area.
Hmm?
Yeah,
They have what? What is this physical exam again?
pustular lesion in the pustular lesion in the perioral and periorbital area.
Perioral, around the mouth, and periorbital
Yeah,
area.
yeah.
I don't know what this one is.
I'm gonna make it a little bit more easier. Patient have
Okay.
Crohn's disease that we did small bowel resection and he's been receiving TPN.
So the patient is deficient in something, you know?
And zinc, yeah.
Oh,
Zinc,
you didn't give me the taste.
yeah, zinc deficiency. They didn't mention the taste.
Really?
Yeah.
Okay, tell me again, what are the skin, hair loss, pustular lesion around the mouth.
Yeah, perioral and periorbital.
Wow, around the mouth and around the eyes.
Yeah.
Let me see if I can Google it. Sometimes pictures help me. Zinc deficiency.
Mm-mm. Yeah.
Huh.
Okay, good question. 42 years.
One second.
Nah.
Zinc deficiency. I just want to, because if we finish now, I'm not even gonna go back and look at some of these things. Oh, okay, I can see the perioral. Okay, go ahead.
If you are a 42-year-old male with fatigue, dark urine, and you are a smoker, when I do your labs, I found the AST to be 55, ALT is 40, alkaline phosphatase is 800, bilirubin total is 11, direct is 8. What's
Tibula is 11, direct is 8,
yeah? What's
and
best
it's a
next?
42-year-old woman,
Male with
male.
fatigue, dark urine.
Okay, I'm thinking maybe like what do you call it? Primary sclerosing cholangitis. Is that what it is?
Yeah, but what is best next step?
Oh, best next step. Okay, you can do I think you do is it a okay, in this one, first of all, you can do right upper abdominal ultrasound, and then you can also do MRCP or ERCP, right?
Yeah, right upper corner ultrasound. Good job. Now, this is an easy case of peritonitis. I'm not gonna waste your time. Okay, if you are a 45-year-old male with AST of 240 and ALT
Mm-hmm.
is 150, okay?
Mm-hmm.
Your sodium is everything else is normal. So what do you need to ask this patient about? Or what's going on here? What's diagnosis?
The what you gave me didn't correlate with maybe like alcohol, because alcohol will be 2 to 1, right?
Yeah, so you gotta ask him about alcohol.
Mm-hmm.
Yay, good job. Let's go to the next one. If you are a 46-year-old male with right upper quadrant fullness and obesity, on exam you have acanthosis nigricans over the neck creases and hepatomegaly. AST is 120, ALT is 130, alkaline phosphatase is 100. What is your diagnosis? Or what else do you expect? This patient, yeah, what is their diagnosis? Yeah.
Hmm. Hepatomegaly,
Mm-hmm.
acanthosis nigricans.
Mm-mm.
I know this doesn't look like a diabetes, and right upper quadrant pain with hepatomegaly. Hmm. And he's a male. Hmm. I don't know. What is it?
So this is called non-alcoholic fatty liver
Oh,
disease.
NASH. Oh, okay.
Yeah, they have acanthosis nigricans
They do?
and hepatomegaly. So,
Metabolic syndrome, okay.
so how do we
Okay,
treat
let's see.
that?
How do you treat it? I guess you can cancel them and tell them to lose weight and all that.
Bariatric surgery if the BMI is more than 40, I think.
Lifestyle modifications first.
More than 30, yeah, yeah. First, live diet and exercise, and then
Hmm.
bariatric surgery. BMI more than 35, actually. Yeah.
You know, there's something they do now.
What is it?
They call it's like a light therapy.
Oh
They call
wow,
it red
how
light.
does that
Yeah.
work?
What they do is they use the light, and then just put it on your stomach, And then what it does, it's like a light therapy. You come into the doctor's office and they do it for like how many times? Do you have like a package? And it's just targeted to remove the, fats around the liver, around your abdomen. Red light therapy.
Wow, interesting. Wow, even I was reading an article. This was very interesting. Like they just invented a drugs called Zomotiga or something like that. It's a gene therapy used for kids who have muscular dystrophy, neuromuscular dystrophy, before
Mm-hmm.
before 2 years of age. So they inject. It's a virus. This medication is about a virus
Mm-hmm.
that genetically modify the individuals and give them that gene, which is very interesting. Guess how much does it cost?
How much?
$2 million.
Ooh, who in the world is even gonna do that?
Yeah, but what I got,
How do people qualify for that treatment?
like if they have a neuromuscular dystrophy less than 2 years.
Mm-hmm.
Yeah, but you know what I got from that, like the
Mm-hmm.
the wisdom that I got from that is that you have 20,000 gene in your body
Mm-hmm.
that you didn't pay for. They
I
just came for you
know.
free. Like you mean you worth more than how much if you multiply 20,000 by 2 million, you were more than 40,000 million dollar.
Oh wow. Wow,
Yeah.
wow, wow, wow. That's very interesting.
Yeah, that's interesting. See. Yeah, so
So this
NASH,
life is basically priceless. That's what it is.
that's true, yeah. It is.
Wow.
Yeah, so the NASH, they have hepatic steatosis on imaging,
Mm-hmm.
exclusion of significant alcohol use, and exclusion of other causes of fatty liver. That's the definition of it.
I mean, very unfortunate. I had a patient when I was doing my clinicals that developed cirrhosis from this.
Really, wow.
Yeah, I was like, oh my goodness, that is so unfortunate.
It's crazy, yeah.
She was not drinking, she was not smoking, just NASH, and now she has cirrhosis.
Wow, that's tough, yeah. Yeah, so most of the time they present asymptomatically, but they can have metabolic syndrome,
Hmm.
and they can have steatohepatitis, which is AST over ALT less than 1, like
Mm-hmm.
this guy, and hyperechoic texture on ultrasound.
Hyperechoic texture. Okay.
Okay, so what do you give for a patient with esophageal varices? Non-bleeding,
That is not bleeding.
yeah. Just beta
Um,
blocker, just give 'em.
yeah.
Okay, if you are a 23-year-old male with a 2-month history of loose stool, decreased appetite, weight loss, hemoglobin of 11, platelet of 500,000, ESR of 50, the stool
Hold
ought
on. You said hemoglobin of 11, platelet of how many?
500,000 and ESR of 50,
Hmm.
and stool for occult blood is positive. So what type of diarrhea is that?
Stool for occult blood. Okay, occult blood. Oh, is positive.
Yeah. What type of diarrhea? Inflammatory, secretory, osmotic?
I'm gonna say inflammatory. This looks like Crohn's. Is it?
Yeah,
Hmm?
good job, yeah. Yeah, yeah. Inflammatory.
Inflammatory. Okay.
Okay. Now, how does alcoholic hepatitis present?
Alcoholic hepatitis. Okay. So the AST/ALT is gonna be maybe in the thousands, right? ALT, AST. Okay, patients is gonna come in with fever. Okay. So there will be fever, there will be abdominal pain, and then also when you do the lab, you see like a very, very, really, really elevated LT, AST, and in the ratio of 2 to 1. And then sometimes they also have all these other things going on.
Yeah, so the presentation of jaundice, anorexia, fever, right upper quadrant pain, abdominal
Mm-hmm.
distension due to ascites, proximal muscle weakness from muscle wasting if malnourished, possible hepatic encephalopathy they can have that.
Mm.
On labs, you have AST, ALT usually less than 300.
Or less than 300?
Yeah,
It's not thousands?
no, no.
Really?
Yeah, AST to ALT
So
ratio more
which
than
one? Oh,
2.
alcoholic hepatitis is not viral.
Yeah, you know.
I don't know. Let's mix it up.
Yeah, AST, ALT more than 2.
Hmm.
Uh, yeah, viral will be ALT, AST more than 2. Now, GGT will be high, bilirubin INR will be high, leukocytosis,
Hmm.
decreased albumin, abdominal imaging may show fatty liver.
Hmm.
That's the thing. Now, if you have a lipase of 3000, okay, and there is cups of yellow red papules seen on extensor surfaces of the arm. So, what could yield the diagnosis in this patient?
Patient has lipase of 3,000
Yeah,
and has what again?
cups of yellow red papule on the
Oh,
lid
crops
margin,
of
eyelid,
red,
on the
yellow,
eyelid,
purples.
on the eyelid or in the arm, whatever.
Okay. So,
Xanthelasma.
huh? Xanthochromia.
Yeah. So this is you order fasting lipid profile. This is gonna tell you
Hmm.
what's
Hmm.
causing acute pancreatitis. So we know that the lipid can cause other
Pancreatitis due to triglyceridemia.
yeah there are other causes gallstone 40% alcoholic 40% of the cases and 20% the other 20% could be triglyceride azathioprine valproate thiazide CMV legionella aspergillus post ERCP ischemia. Okay, so to diagnose you need two of the three either pain radiating to the back epigastric pain or increased amylase or lipase more than 3 times normal. If you have two, no, you don't need imaging. But if the pain atypical or normal labs, then you do imaging. You find abnormalities consistent of pancreatitis. Other finding, ALT, you have in more than 150, such as biliary pancreatitis. Okay,
Hmm.
so that's a trick. Okay, be careful from that.
Okay.
If they,
So you said if you have more than two of these, just go straight to treatment. You don't need imaging for diagnosis. Is that what you're saying?
exactly, yeah. And there are severe cases present with fever, tachypnea, hypoxemia, and hypotension. Okay, now if you are a 45-year-old woman with persistent abdominal pain that began 12 hours ago, okay, when I examine you, I found you have fever, blood pressure 100/70, pulse is 110. Abdominal exam,
Pulse is 110. Okay.
yeah, chest X-ray shows left-sided pleural effusion. So this is pancreatitis. Yeah. So what's your diagnosis?
Left-sided pleural effusion.
Yeah, with epigastric pain radiating to the back.
Okay.
Yeah. So this is
This is back
complicated.
at.
Complicated acute pancreatitis.
Hmm.
Okay. So this is. So what are the other complications of pancreatitis?
So complications of pancreatitis. Okay. They can have pseudocyst, right? They can have a pancreatic abscess. They can have uh,
Necrosis.
necrosis. What else?
ARDS.
They are what?
ARDS.
Oh, arts. Yeah,
Acute
yeah. That's
respiratory
this
distress
time.
syndrome. Ileus. In 30 cases of 30% of pancreatitis have ileus. And pleural effusion. Okay. Now, 27-year-old guy
Mm-hmm.
from Mexico have pain in the epigastrium, okay, that wakes him up at night and relieved with water, piece of bread. And he has occasional dark stool. So how do you treat that?
Treat,
Mm,
not diagnose.
mm,
Okay. If you're not gonna diagnose, you can treat. You can start with PPI for like 6 weeks and see if it's gonna get better before you do. So PPI treatment before endoscopy.
yeah, yeah. But what if the patient have H. pylori?
Okay, if the patient, that's what I'm asking you. Do you want to treat before you diagnose? If the patient has H. pylori, then you're gonna do the triple whatever treatment. So you do the clarithromycin,
And yeah,
amoxicillin,
yeah,
and
amoxicillin.
PPI.
Yeah, yeah. If you're a
Yeah.
52-year-old male who came to the physician due to black stools and occasional abdominal discomfort and nausea, okay? Food help your abdominal pain. Okay, and you gained 5 pounds over the last year.
Hmm.
Physical exam shows mild epigastric tenderness and right-sided carotid bruit.
Right-sided what?
Carotid bruit.
Right-sided carotid bruit.
Yeah, so what? So the abdominal pain, nausea, black stool. What is your diagnosis? You gained 5 pounds.
So I'm thinking duodenal ulcer.
Yeah, yeah, peptic ulcer disease and
Yeah, peptic. Yeah. Hmm. Not gastric.
duodenal ulcer. Yeah, smart. Good job. Yeah, because gastric usually, let's see, they have pain worse with food. Yeah, so that's why.
And they
Yeah.
have
Okay.
weight loss.
Yeah, yeah. So 45. If you are a 45-year-old male with hepatitis C and you had varicose bleeding and all of these good stuff on chest X. Hello. Can you,
Hmm.
yeah, on chest X-ray, there is moderate to severe right pleural effusion and small left pleural effusion. Right-sided thoracentesis shows transitive effusion. So how do you treat that? Or what's your
Hmm.
diagnosis and how do you treat it?
Okay, you gave me too many things. So 45-year-old Hep C, varicose bleeding, or history of varicose bleeding, or what?
Yeah, so he's having abdominal distension plus
Okay.
pleural effusion.
Hmm.
So what do we call this condition?
Um. So abdominal
This is
distension
called
plus
hepatic hydrothorax.
hepatic hydrothorax.
Yeah,
Okay.
when you have ascites, this you may go to the lung, and then so the treatment for that you do TIPS,
Hmm.
transjugular and tribe. So first you do therapeutic thoracentesis. Second thing you do restrict diet and give diuretics, and then if those failed, you do TIPS.
Hmm.
Transjugular. Okay, now if you're a 52-year-old woman, when the physician places a stethoscope over your upper abdomen and rocks you back and forth,
Oh, what do you
why
call it?
why would he do that?
Is it succular splash or something
Succussion,
like?
seplastia, why?
Yeah,
Uh,
gastric outlet obstruction.
yeah, so if that was positive, how do you treat that?
How do you treat it? I think it's gonna be, because it's an obstruction, it's gonna be like surgery to dilate the, right?
Yeah, you do the first you do NG tube
Hmm.
just to decompress the bladder stomach, give him
Sure.
IV fluid and endoscopy to diagnose what the hell's going on. Okay. Now, if you're 75-year-old male with a new right upper lobe infiltrate, and
Upper what?
right upper lobe infiltrate.
Mm-hmm.
Okay,
Mm-hmm.
so you had multiple episodes of hypotension. You have sepsis. Okay, blood pressure
Mm-hmm.
70 over 40. But after that, I checked your labs. I found the AST to be 3000, ALT 3000. What's going on here?
Um, so this will be, what do you call it? Is it liver hepatic ischemia infection due to hypertension?
Yeah, ischemic hepatic injury. Good job. Yeah.
Yeah.
Now, if you are a 60-year-old who
Mm-hmm.
have alcoholic cirrhosis, okay,
Mm-hmm.
oral intake is poor, and you refuse to get out of bed for the last 2 days. Okay, so you have cirrhosis. So now I came to examine you. I found tremor and outstretched hand.
Mm-hmm.
Your potassium is 3. So how can I treat your condition here?
Okay, so this patient has a cirrhosis, potassium of 3. I'm trying to
Not just
differentiate.
not just cirrhosis. When you have tremor, that's a hepatic encephalopathy, right?
Uh-huh. It can be that or it can be SBP, right?
Then yeah, but he's having tremor confusion.
Okay, okay. If he's having confusion, then hepatic encephalopathy.
Yeah,
And then you can do lactulose or rifaximin, all those ones.
yeah, but the potassium is 3, so that's what precipitates hepatic encephalopathy. So the first thing first. So I'll just
Mm-hmm.
correct the potassium first. So the management of hepatic encephalopathy first supportive, like volume repletion if needed, restrain if agitated, correct electrolyte. That's number one. Second
Mm-hmm.
thing, adequate nutrition without protein restricted diet unless the patient is unable to tolerate protein intake. Third thing, treat precipitating cause like GI bleed, hypovolemia. After that, if there's infection, electrolyte abnormalities, you treat that. After that, you lower serum ammonia. That's the last thing, which is either you giving lactulose orally or enema if unable to take orally lactulose. And then when do you give rifaximin?
If you don't have any, what do you call it? I think if the lactulose doesn't work within 2 days, then you can do rifaximin, right?
Wow, good job. Yeah, within 48 hours, if lactose didn't work, and or if the patient can't take lactulose, then you give him rifaximin. Okay, if
Okay.
you're a 54
Mm-hmm.
male with several days of persistent abdominal pain, nausea, vomiting, low grade fever, appetite loss, what do you think is going on?
Okay.
Mm.
Persistent abdominal pain, nausea, vomiting, fever, appetite loss.
Yeah.
Um, it can be anything. You know, what you gave me, I don't think is gonna help me.
Patient taking medication for seizure disorder. So this is valproic induced pancreatitis.
Yeah.
Yeah, they didn't give much information. Like they just gave you, but the answer choices will help you find out.
Okay, to go back and
Yeah, by exclusion and stuff. Yeah, sometimes there's a question like, okay, if you're a 45-year-old Hispanic male who have abdominal pain, bloody diarrhea for similar episode in the past year.
abdominal pain,
Yeah,
bloody diarrhea.
yeah.
Uh-huh.
When I do endoscopy, I found extensive disease from the terminal ileum to the rectum with multiple ulceration and pseudo polyp.
Mm-hmm. You see,
Uh, what is
ulcerative colitis,
biopsy shows non-caseous granuloma and crypt abscess.
ulcerative colitis.
No, no, this is a Crohn because I said non-caseous granuloma.
Yeah.
Huh?
So I didn't let you finish. Okay, yeah, if you
Yeah,
have granuloma, then it's Crohn's. If you don't
yeah,
have
yeah,
granuloma, it sounds more like UC.
yeah, yeah.
Because I know that Crohn's, most of the time, it's not going to be bloody diarrhea. It's going to be just occult positive.
Yeah, UC Davis, you mean?
Huh?
UC Davis? No, I'm joking.
Davis?
I'm joking with you. Yeah, like, there's a program UC Davis. It's like University of California. Okay, so now if you're a 54-year-old woman with
Mm-hmm.
epigastric pain for
Mm-hmm.
the last 2 months,
Mm-hmm.
you lost weight. Okay,
Mm-hmm.
I think it's clear by now, like relatively back pain radiating to the back for the past 2 months, plus weight loss. What do you think?
Are you talking about chronic pancreatitis?
Yeah, so you gotta do CT of the abdomen with contrast. Could be chronic
Mm-hmm.
pancreatitis, could be pancreatic adenocarcinoma. So
Mm-hmm.
the risk factors, they have smoking, hereditary pancreatitis, non-hereditary chronic pancreatitis, obesity, and lack of physical activity.
Mm.
So what? How does that present?
Which one?
Pancreatic adenocarcinoma.
Uh-huh. You will present with more like abdominal fullness or, just like not really like sharp abdominal pain. In the mid AP gastric, sometimes they'll have like what do you call it? Just very vague, symptoms, more especially at night, for the pancreatic cancer. And weight loss, of course, and poor appetite, things like, and then history of a smoking. Most of the time they will give you history of smoking. Sometimes they will give you history of a chronic pancreatitis. You know,
Yeah, systemic symptoms: weight loss,
yeah.
anorexia, abdominal
Hmm.
pain, back pain, jaundice, recent onset atypical diabetes mellitus, unexplained migratory superficial thrombophlebitis, hepatomegaly,
Hmm.
ascites with metastasis. On
Okay.
labs, you have an increased alkaline phosphatase and direct bilirubin.
Hmm.
Okay.
And then they say sometimes, when they have jaundice, then is the pancreatic cancer of the head of the pancreas, right?
Yeah,
If they
right.
don't have a jaundice, then it will be the body and tail of the pancreas.
Yeah, yeah. And yeah, and causes, elderly, like 50 years old guy with type 1 diabetes.
Hmm.
That's
Okay.
how it's going. New onset type 1 diabetes. And then it causes increased cancer associated antigen 19.9. It's
Hmm.
not a screening test, just to monitor therapy. And then increased abdominal ultrasound we can do if jaundiced. How
Hmm.
about if the patient doesn't have jaundice? What test do we?
CT.
Yeah, yeah, good job. Smart. Wow.
You are smart
Good
too,
job. Yeah,
Dr. Ali.
I'm privileged to discuss these cases with you.
I am too. You
Thank you.
got me like at the right time.
Yeah, that's true. Yeah, that's gonna help a lot of students too. So I wanna make this life is too short. So I'm gonna I want to create something meaningful for other people
That's very
to
good.
help
I'm
them.
very
So
proud of you.
you and I are creating a product that's gonna help people. So we're proud of this. Yeah. So this is good.
Awesome. Good job.
Yeah.
You have a student.
Yeah. Yeah. So
That's
yeah.
good.
Yeah. Yeah.
I'm
So
proud of you.
thank you. I appreciate it. Yeah. So now if you are a 45-year-old nurse practitioner with a painful abdominal cramps, watery diarrhea, you has a lot about 10 to 20 bowel movements a day and nocturnal bowel movement. When I do endoscopy, I found dark brown discoloration of the colon with lymph follicles shining through as pale patches. What is your diagnosis?
Laxative overdose or
Factitious. Yeah,
overuse. Yeah.
factitious.
Hmm. Using a lot of laxatives, yeah.
The factitious diarrhea, porcelain gallbladder associated with gallbladder adenocarcinoma, calcification of the bladder. You know that. Okay, now 43-year-old with a bloody vomiting, varicose, and you were hospital.
Bloody vomiting, okay.
Yeah, so due to varicose bleeding, and so
Mm-hmm.
they did varicose band ligation 5 months ago.
Mm-hmm.
Okay, so what do you do now? You have another episode of bloody vomiting now. What do you do?
Mm-hmm. 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 Okay.
First thing,
Um,
now
First
you're
thing,
vomiting
uh,
of
the
blood.
the the,
Yes.
A- the
What should I?
ABC.
Yeah, intubate. Good job.
Okay, so the ABC, yeah. Okay. Yeah, if you're vomiting blood. Okay, fine.
Yeah, good job. Intubate. Now, if you're a 44-year-old
Mm-hmm.
male with vomiting, small amount of bright red blood, and confusion, and you have jerking in your hand, so this is hepatic encephalopathy. So just give him lactulose, and
Okay.
he will be better. Yeah. Now, if you're a 34-year-old male with 4 weeks of history of diarrhea, and you had a trip to South America, and where you developed foul-smelling stool, abdominal cramps, and bloating.
Mm-hmm.
So
Giardia?
yeah, so we gotta test stool antigen for giardia. Good job. Yeah.
Mm-hmm.
Now, if you're a 22-year-old male who's fasting and developed total bilirubin of 3.4 and indirect bilirubin of 2.8, what's your
Hold
diagnosis?
on. A 22-year-old fasting?
Fasting hyperbilirubinemia. What is diagnosis?
Oh, okay. Gilbert?
Gilbert, good job. Yeah.
Mm-hmm.
Now, if you're 65 with a dark maroon colored stool and 3 out of 6 systolic ejection murmur at the right second intercostal space.
Mm-hmm.
So what's causing this right dark maroon colored stool?
AV fistula? AV malformation?
No, so this when you have 3 out of 6 systolic ejection murmur, that's most likely
Mm-hmm.
aortic stenosis. And then I tell you dark color, maroon colored stool, that's angiodysplasia associated with
Yeah.
aortic
Yeah,
stenosis.
angiodysphagia, right? Yeah.
Aortic stenosis and end-stage renal disease, because aortic stenosis, won't allow von Willebrand factor to pass through, so to destroy von
Mm-hmm.
Willebrand. So the vessels tend to bleed in the gut because there's no von Willebrand. It's like
Mm-hmm.
acquired von Willebrand factor deficiency, so increased tendency for bleeding because
Mm-hmm.
von Willebrand inhibits bleeding. Okay, if you're a 44-year-old male with splenomegaly and echogenic shrunken liver without obvious mass, AST,
Echogenic shrinking liver?
yeah, without obvious mass,
Mm-hmm.
alkaline phosphatase is 130, AST is 282, alanine aminotransferase 120. What's best
Mm-hmm.
next step?
Um, so this patient, I think, maybe alcoholic, hepatitis, and now has cirrhosis. Okay. So you've already done abdominal ultrasound, right? So
Yeah, so someone,
let's say this patient. Okay.
yeah, so if anyone who presents with cirrhosis, what is the first thing you do? You do a periodic surveillance of liver function test,
Mm-hmm.
INR, albumin, and bilirubin. You do
Mm-hmm.
this. If it's compensated, what do you do?
If it's compensated,
You do
then
ultrasound every six
right
months
of the right.
for
Mm-hmm.
just to screen for hepatocellular carcinoma,
Mm-hmm.
and EGD varies his surveillance. Okay, that's it.
Right.
If it's compensated.
With
Okay, so this patient had it compensated. So you gotta do esophageal varices, EGD for esophageal varices,
mm-hmm.
because you just present with cirrhosis and
Mm-hmm.
but if it's decompensated, you look at it. If it's variceal hemorrhage, you give him non-selective beta blocker and repeat EGD every year. How about if it's ascites? What do you do?
So for ascites, you're gonna do the what do you call it? Pericardiocentesis. You tap
Yeah,
it, and then
yeah,
you
paracentesis.
also paracentesis. I say pericardial paracentesis, and then you're also gonna put them on prophylaxis. I think you do. Is it Cipro, right? Fluoroquinolone.
That's for small intestinal bacterial overgrowth, but the ascites, yeah, but aside, yeah, you can give him that because they increase risk for that. The main therapy for ascites: decrease sodium intake. One. Second thing, diuretic. Third one, paracentesis. Fourth is abstain from alcohol.
Mm.
Yeah, and hepatic encephalopathy, you treat underlying cause, infection or GI bleed, and lactulose. Okay.
Mm.
Yeah.
So they didn't say about the prophylaxis, giving prophylaxis for SBP.
Yeah, for SPB you give fluoroquinone. Yeah.
Okay.
Now, if you're a 65-year-old woman with fatigue and dyspnea and 2 out of 6 mid-systolic murmur in the second left intercostal space, your iron is 26. Iron binding capacity is 474.
Okay, your iron is what, 26?
Yeah. And iron binding capacity? Yeah.
What is so funny?
No, so I wanted. I was yawning like while I was talking. It was funny.
I was waiting for you to finish and then you started yawning.
Yeah, yeah. So now, he presented with a 2 months history of fatigue, dyspnea on exertion, and there is 2 out of 6 mid-systolic murmur in the second left intercostal space with a normal S2 splitting. MCV 74. Okay, so what's
Mm-hmm.
hemoglobin is decreased 8.6. So what's best next step for this guy? Fatigue and MCV 70.
Colonoscopy.
Yeah, endoscopy and colonoscopy. Good job. What causes steatorrhea?
What causes what?
Steatorrhea.
Osteoarthria.
Yeah.
Malabsorption, right?
Yeah, which one?
Okay.
There's a
Oh, okay.
huge list.
Okay, so celiac disease, lactulose, of course, intolerance, Whipple disease, tropical disease, and the pancreatic deficiency that can be due to cystic fibrosis and things like that, chronic pancreatitis.
Yeah, chronic pancreatitis, pancreatic cancer, small bowel Crohn, bacterial
Mm-hmm.
overgrowth, primary biliary cirrhosis, sclerosing cholangitis, surgical resection of ileum at least 60 to 100 cm, celiac, AIDS, enteropathy, giardiasis, Whipple, Zollinger, Ellison, medication. So those are the stuff, good
It's a
stuff.
long list.
Yeah. So 57-year-old male with a chest pain that is burning in nature. He lost 40 pounds on the last 6 months, and he carefully he chewed the food before swallowing,
Mm-hmm.
and he's a 20-pack year smoking history.
Mm-hmm.
What's best next step?
EGD.
No,
You yawning?
no. Hmm?
Are you yawning?
No,
Are you drinking your tea?
no. I'm just drinking water. Yeah. So you do.
So this is chest. This is okay. You said burning pain in
Yeah.
nature.
So you do EGD.
Yeah,
Yeah.
that's what I said.
Yeah. I was just messing with you.
Oh
Yeah.
my goodness.
Yeah. So you
I
do.
think you're too hyper today.
Yeah. Yeah. So you do EGD. So squamous cell carcinoma can be anywhere in the esophagus, but the adenocarcinoma distal from
Mm-hmm.
Barrett esophagus. Make sure you know that. So you do CT endoscopy with biopsy, and then you do CT PET scan for staging. Okay. Now, if you are 55-year-old with type 2 diabetes, hypertension, you presented with pedal edema and abdominal distension over the last 6 months. Exam shows ascites, bilateral gynecomastia, spider angioma. So what's diagnosis here?
Cirrhosis?
Yeah, it's a chronic viral infection because he drinks alcohol occasionally.
Mm-hmm.
So this when you have someone who presented with liver issue and
Mm-hmm.
he drinks alcohol occasionally. So most common cause of hepatitis either viral or alcoholic. So if he drinks
Mm-hmm.
alcohol mildly, then it's most likely
Mm-hmm.
viral. Okay.
Mm-hmm.
So what are the causes of cirrhosis?
Hmm. Causes of
Yeah, the
cirrhosis.
common one. What are the common one? What are the less common?
So, of course, we'll start with the alcohol can cause cirrhosis. So alcohol, Hep A, Hep B, Hep C, hepatitis, viral hepatitis, NASH, um, what else? Then hemochromatocytosis, right? I don't know about Wilson. Does Wilson cause liver disease?
Yeah, it does.
Okay, Wilson. What else?
So
Those are the ones that I know.
there are the common ones, which is one chronic hepatitis B or C,
Mm-hmm.
mostly IV drug abuser, multiple sexual partner, blood transfusion,
Mm-hmm.
alcoholic liver disease, excess alcohol, NASH, non-alcoholic fatty liver, if you have diabetes, metabolic syndrome, hemochromatosis,
Mm-hmm.
like Brown's diabetes. So those are the common. The less common, like autoimmune, primary biliary cirrhosis, primary sclerosing cholangitis, associated with inflammatory bowel disease, or biliary cirrhosis associated in women, pruritus and increased alkaline phosphatase, and autoimmune associated with anti-smooth muscle antibody,
Mm-hmm.
or it can be alpha-1 antitrypsin deficiency, lung and heart and
Sure.
liver. Cardiac cirrhosis can cause that, right heart failure. Medication like methotrexate, isoniazid cause that. Wilson disease, Kaiser-Fleischer ring, cirrhosis at young age, those sorts of things. Now, if you are a 54 male with
Mm-hmm.
bitter taste and substernal burning 40 minutes after meal. Okay, burning relieved by antacid and worsened by lying supine. So what should I do now?
Bitter taste, substernal burning,
Yeah.
and what else?
So you gotta do EGD because he's above 50. That's it.
Alarm symptoms, yeah.
Yeah, alarming. He's having weight loss. So yeah, so someone presented with GERD and have alarming symptoms, you do EGD.
Mm-hmm.
Okay, if you found esophagitis, yeah, treat according to diagnosis. If
Mm-hmm.
there is no esophagitis, what do you do?
Okay.
You do
I just
esophageal manometry,
mm,
impedance testing, and gastric scintigraphy. You do that if there's no esophagitis.
okay.
Okay, how about if there's no alarm symptoms? You go for PPI already.
Mm-hmm. Mm-hmm.
Okay. If
And
symptoms
650.
controlled, then continue. If it persists, then you do EGD or esophageal pH monitoring.
Okay.
So that's about GERD. Now, okay, good. Now, if you're a 57-year-old male with arthralgia,
With
increased
what?
arthralgia for the
Okay.
past 8 years,
Mm-hmm.
and exam shows vesicles and erosions on dorsum of both hands.
Erosions on dorsum of both hands. Okay.
Yeah. So AST/ALT 40 each. So what's your diagnosis here?
Erosions on dorsum of both hands.
So
Um.
this is,
eh,
hepatitis C.
Oh, what do you call it? Don't tell me. Cutaneous something
Yeah,
porphyria.
causes porphyria cutaneous tarda, lichen
Mm-hmm.
planus.
Mm-hmm.
It can cause membranous proliferative glomerulonephritis, cause mixed granulocytopenia. It can cause increased risk of diabetes. Very interesting. Presentation, yeah, it can cause everything. Presentation can be asymptomatic
Mm-hmm.
or develop fatigue, most common. Other non-specific symptoms: nausea, anorexia, myalgia, arthralgia, weakness, weight loss. Those are the things. Serum
Mm-hmm.
transaminase can be elevated or normal. Can progress to cirrhosis in 20% of patients,
Mm-hmm.
and an increased risk for what? Hepatocellular carcinoma.
Break time.
Yeah, you're right. However, I got two more questions and I'll be done with the first part.
Oh, okay.
Okay?
Sure.
20-year-old university student with
Mm-hmm.
cryptopsis, that's an ulcerative colitis.
With what?
Cryptopsis? Yeah,
Cryptosis?
cryptopsis on
Oh, okay,
virus.
okay, okay.
So this is
Sure.
ulcerative colitis, cause erythema,
Mm-hmm.
friable mucosa, pseudopolyp in the
Uh-huh.
rectosigmoid, no
Uh-huh.
skip lesion, crypt abscess, mucosa, submucosal inflammation. That's how they describe it.
Mm-hmm.
Complication can cause toxic megacolon, primary
Mm-hmm.
sclerosing cholangitis, colon cancer, erythema nodosum, pyoderma
Mm-hmm.
gangrenosum,
Mm-hmm.
spondyloarthropathy. Those are the things. And then last but not least, no, we'll continue there. There's miscellaneous questions. We'll continue them in the next session. Let's take a break right now.